Hello and welcome to a special interview for The Wire. Once again, COVID-19 cases are increasing right across the country. So today we ask, how serious is the situation and what should the government do? Joining me to answer those two critical questions is the professor at the Wellcome Trust Research Laboratory at the Christian Medical College in Vellore and India's top vaccine scientist, Gagandeep Kang. Professor Kang, let's start with the surge in cases, which the Hindustan Times reports is happening in 17 states and union territories. How worrying is this situation?
I actually went and looked at the data to try and figure out where we needed to worry and where this might not be as concerning an upswing. And the only places where I see real cause for concern is in Maharashtra, Punjab, and in Chandigarh, whereas the other places seem sort of reasonably off. States that border Maharashtra, such as Gujarat and Madhya Pradesh, are also seeing an uptick, but it's nothing like the number of cases that are being seen in Maharashtra.
So you say the area of concern, the area of worry are limited to Maharashtra, Punjab, and Chandigarh. In the other areas, we are seeing surges, but they are not particularly worrying at this moment. Have I understood correctly?
That's correct.
In which case, how do you explain the worrying surge in Maharashtra, Punjab, and Chandigarh? Is it because of lax and careless COVID behavior, or could it be because infectious mutations of the virus are now beginning to predominate?
So I think there are three reasons why cases would increase. One, obviously, is a lack of the kind of preventive behaviors that we have encouraged over the past year and more. And in many places, I think the rise that we are seeing is because some parts of the population have decided, either for fatigue or thinking that this is not their problem, have ignored the need for masking and for avoiding crowds. But those numbers are not driving the sharp upswings that we are seeing in a place like Maharashtra. And there also, it's limited to really Mumbai, Thane, and Pune, with a little offshoot in Nagpur. I think there are two explanations. One is a potential variant, and we've been told by the government that there are no variants of concern in this area, but it may be that the sequencing is not necessarily keeping pace with the upswing in cases. So it is distinctly possible that we may have variants. The question is this a variant that was imported into Mumbai and then has spread? Or is this a locally prevalent variant? And I think either of those are possible. More likely the latter, given that we have been told that there has been a reasonable amount of sequencing in Maharashtra and they have not detected imported variants of concern. The other is a super spreading event that may have happened and may have resulted in consequent offshoots of infection continuing to spread. It could possibly be a combination of the two.
How concerned are you by the fact that you think it's probably more likely that if it is a more infectious variant, it's a locally produced one, not an imported one? Because if it's locally produced, does that suggest it could spread a lot further and it may be embedded in many different pockets?
Variants arise all the time. And each time the virus replicates, you have a chance of a mutation, of several mutations, some of which might be linked together. What we are seeing around the globe is that certain variants or certain kinds of mutations are arising in variants that have become a concern for us. And those variants are the ones that are more transmissible or the ones that allow for the virus to escape the immune response that is induced by a prior infection or vaccination. Now,
But
given the fact that in Maharashtra, in Mumbai, I believe the bulk of the cases that they are seeing are asymptomatic or very mild infections, which means the numbers are going up, but not necessarily the severity of disease. I think it's possible that we might have an immune escape variant that's also very transmissible that has arisen locally. We've seen this before. We saw this on 3 different continents. There's no reason why Asia should be an exception.
But there's no reason to jump to the conclusion that a local Indian variant would be more infectious or more lethal than an imported one. We simply can't make that distinction.
Not at all. I think the pieces of data that we require to be able to build a fuller picture require clinical information on the cases. And here we only have press reports that say that most disease is either most infection is asymptomatic or resulting in mild disease. We also need epidemiological information that tells us who is spreading to whom, where, and when. And we need information on the virus telling us what are the mutations or constellation of mutations that we are seeing.
2 more questions on this particular issue. Are we in danger of seeing the sort of spikes we saw last year? I noticed that between mid-February and today, the 7-day rolling average of daily cases has actually doubled. In other words, it's doubled in just a month. So could we see the same sort of spikes as we saw in September when they were increasing by something like 95,000 a day?
I don't think we will see spikes like that. And here again, I'd like to emphasize that there is a difference between infection and disease, between the cases that we are detecting and the public health problem, the clinical problem, which is treating people with disease. If cases go up, that is an indication that the virus is spreading, that it is in the community. But if it is causing severe disease and deaths, that's where it becomes more of a problem for us to handle. And if we know that this is a hugely more transmissible virus, then we should be doing everything that we can to restrict that spread. And if it is a more severe disease-causing virus, then we should be preparing our clinical facilities to be handling that upsurge of cases, even as we try to limit spread through non-pharmaceutical interventions and vaccination.
Hidden in your answer was a suggestion, and you said this twice, that we're seeing an increase of asymptomatic cases or mild diseases. Does that suggest that this surge in Maharashtra in particular is not producing serious disease? And does it also suggest, as some newspaper reports have said, that the mortality rate this time around is a lot lower than it was last year? Are both of those inferences things that follow from the fact that asymptomatic and mild disease is increasing?
So one of the things to think about is that we expect that in Maharashtra, in Mumbai in particular, at least 50% of the population in slum areas has already been infected. And it was about 20% in the high-rise buildings. That was in August of last year. It's likely that the percentages of people who have been exposed has increased greatly since then. And if these people are being infected again because of a variant, which again is not something that we know, we would expect that infection and consequently disease would be modified in these individuals. You would not expect to see as severe disease the second time around when a person gets infected as you did the first time.
That's very clear. Let me then come at this point to the key question, what should the government do? First of all, in areas where the infection is growing or surging, the 3 you mentioned are Maharashtra, Punjab, and Chandigarh, should the government carry out a blanket vaccination campaign. In other words, to use a popular term, a blitzkrieg that covers everyone over the age of 18 in these special areas?
That would certainly be a good way of thinking about control of the virus. But I also think that we should be thinking at a much more local level. Much of the spread of transmission, whether we have a variant that is very highly transmissible or what we could call a normal virus, the spread happens because of people's behavior. So whether we go with an approach where in areas where we are seeing increases above a certain threshold, we should introduce blanket vaccination. I think that is a policy for the government to make, but it would be a very reasonable one to think about and would definitely help in slowing the spread of infection. The important thing to remember is that vaccine-induced protection takes time to kick in, at least 2 weeks after the second dose of the vaccine. So therefore, vaccination is not a strategy that will result in control tomorrow, but being able to get people to change behavior definitely would slow transmission much earlier.
Let me pick up on that point that there is a need for people to control their behavior, to be cautious, to be safe. Now, on the 29th of this month, in literally 2 weeks' time, India will celebrate Holi. Shortly after that, there are a series of Kumbh Mela Shahi Snans on the 12th, 14th, and 27th of April. And all the way through the rest of this month and next month, there will be elections happening in 5 states. As a consequence of all of these, there will be tens of thousands, if not hundreds of thousands of people at large gatherings, at political rallies, at Shahi Shnans, where clearly there will be no social distancing and it's extremely unlikely there will be mask wearing. Should the government put a curb on these gatherings and rallies and Shnans?
Well, the government has options. It can ensure that only people who are masked enter into areas where activities are happening. The government can look at allowing only vaccinated people to come in, or can offer vaccines which will decrease spread to some extent. The government can increase testing for the number of people, for the people it allows in. I think crowd control is going to be a critical element of what the government should be doing. But I think it's also important for us to remember that we are not today in the situation that we were in a year ago, where the entire country was vulnerable because we had no experience with this infection before. Today, we are in a situation where the last ICMR Sero survey, which was done mostly in, I think, rural areas, shows that about 20% of the population is exposed. And wherever we've looked in cities, that percentage of exposure is much higher, going up to 40, 50 plus percent in parts of some cities and across many cities and states. If that is the case, I don't think we are going to see the numbers of severe disease cases that we saw last year.
Okay.
There will be cases, there will be deaths, this will continue to happen, but I don't think we will be in the situation that we were in previously, unless all of this is caused by a variant which is much more transmissible and causes more severe disease.
Let me quote what you said at the beginning of that answer. Crowd control, you said, will be a critical element of what the government will be or should be doing. Now, 2 days ago, we saw pictures of sadhus congregating in tens of thousands, if not hundreds of thousands, at the Hardwar Kumbh Mela. There was no social distancing, there was no mask wearing, and there were videos that have done the rounds on WhatsApp of these people. More importantly, the new Chief Minister of Uttarakhand has just announced that the policy laid down by his predecessor, that people going to the Kumbh Mela in Hardwar would require RT-PCR tests no longer applies. That need for a testing has been dropped by the new chief minister. Isn't this a sign that instead of ensuring crowd control, the government is allowing religious sentiment to trump the need for caution?
I think there are activities that are important to people, but if we want public health, we have to follow the principles of public health. And the principles for control of a transmissible virus are very clear.
Okay,
You need to.
that is a very clear answer. If you want to control the virus, you want public health, then that clearly sacrifices you have to make to ensure you're safe. Isn't that what you're saying?
Yes, and that is ensuring appropriate behavior for the government to have policies in place that ensure that that behavior can be maintained, and vaccination. These are important.
Very quickly before we end, Professor Kang, let me turn to the vaccination campaign that is presently underway. We have a fairly good idea of how it's panning out in urban India and the nature of the uptake of the virus in urban India. We don't have a similarly clear idea of what's happening in rural India. In fact, there are some reports that rural India's priority in terms of vaccination may have slipped. Do you know how effectively rural India is being handled?
Well, actually, if you look at government vaccination programs, for routine immunization, the government performs better in rural India than it does in parts of urban India, because rural populations are much more settled populations and don't migrate as much, and therefore have registers and identifiers that are available. Perhaps what we are seeing at the moment is that we are still within the priority groups, and priority groups can be very difficult to identify where documentation is a problem. I think for both urban and rural areas, increasing coverage with vaccines is urgent, and the faster we can make this rollout, the better it will be for us.
Let me ask you two questions about AstraZeneca. In India, that's called the Covishield vaccine. Countries like Ireland, Denmark, Norway, Iceland, Bulgaria, Romania, and Thailand have paused or stopped the AstraZeneca vaccine on the grounds that they think it could lead to blood clots. On the other hand, the European Union Medicine Agency and the World Health Organization have both categorically said AstraZeneca is safe. As one of India's leading vaccine scientists, what's your take on this?
There is a meeting at WHO to discuss this tomorrow. But from the numbers that we are seeing, I think within the absence of background rates of these events, it's very hard to say whether there is a signal or not. In countries that do have reasonable mechanisms for tracking their populations and events that happen in those populations, it does not appear that there is a signal. So I think
when you say there is not a signal, can you translate that into ordinary language for laymen? What does it mean?
Sure. So, for example, if I vaccinate, let's say, 3 million people with the vaccine and follow them up for 2 weeks, there will be a certain percentage of people who will have a stroke, will have heart attacks, will have thromboembolic events, which is what we are looking at, something driven by clots. There'll be a certain number that happen in that 3 million in the 2-week period that we follow them up. So when we see a case, is that case more than the baseline level? Is it more than the numbers that we would have expected? Let's say we expected 15 events. If we see 16, is that a signal? If we see 30, that's definitely a signal. But you have to have a range around that. My understanding from the AstraZeneca release is that the numbers that they have seen have been below baseline, which seems to indicate that not all cases of such events are being reported.
In other words, what you're saying, the number of such cases that are being reported as a percentage of the total number of people who've got the AstraZeneca vaccine is very, very small and not a cause for concern. At this moment, you're saying AstraZeneca is not a cause of concern.
That is correct. The data will continue to be followed up. There is a pharmacovigilance center that's called the Uppsala Monitoring Center, to which global reports of safety events are submitted. So in addition to countries doing their own analysis, there will also be a global analysis of wherever these vaccines are being used, and that data will be reviewed by WHO before making a statement about whether this may be a signal or not.
Now, one thing I can say, that the country that's had the greatest number of AstraZeneca vaccinations is the United Kingdom. I believe the figure for the UK is something very close to 12 million AstraZeneca vaccinations. I don't believe the UK has publicly reported any case of blood clots that I'm aware of. Would that, therefore, for the audience who hear this, be reassuring?
I think it's not a question of reporting blood clots, because I'm sure events have been reported. These events happen all the time. The question is, are they related to vaccination? And the only way that you can do that is by doing a causality assessment on the cases that you're seeing. And pharmacovigilance requires that regulators do this periodically for every newly introduced vaccine. If they have not said there is a signal yet, I think what we can go by is that there isn't one in at least 12 million people. It's possible that we might have events that are even rarer. There are many side effects of vaccines that happen.
But before we get into the detail which may throw the audience, the basic point you're making is that if 12 or 13 million people have got the AstraZeneca vaccine in Europe, or rather in just England, the number for Europe is even greater, then the number of people with such cases or events is very small, and it suggests there is nothing wrong with AstraZeneca. People in India who worry should not worry.
That is correct. There will continue to be analysis, and if there is a signal, it will be known.
Absolutely, but at the moment there is no signal, there is no reason for anyone in India to be scared.
Nothing.
We will watch how those countries in Europe behave and what they do, but at the moment there is no reason at all for anyone in India who's taken the AstraZeneca or Covishield to be worried about blood clots. Have I understood that correctly?
That's correct.
One more question about AstraZeneca. How much of a gap should there be between the first jab and the second? The government of India officially says 28 days. The World Health Organization guidelines say a gap between 8 and 12 weeks. And that is also the practice of the British government, which has already given some 11 or 12 million AstraZeneca jabs. Now, this is an issue on which many people in India who've taken Covishield are confused, and they want clear guidance and advice. What would you, as a leading vaccine scientist, say to people? When should they have their second jab? After 28 days or after a gap of 8, 12 weeks?
The government of India recommends 4 to 6 weeks. WHO recommends a longer gap, and there is both immunogenicity and efficacy data that supports the WHO position. So the longer gap does lead to a better immune response and to better efficacy of the vaccine.
So, speaking for yourself, surely that answer means you're suggesting to the audience a longer gap means better immunogenicity and efficacy. Therefore, let the gap be between 8 and 12 weeks. Isn't that what you're saying?
That's what the science says. And the government is recommending that we have a shorter gap at the moment, which is the correct gap based on the regulatory approval for this vaccine. But if you change the gap, it becomes something that is called off-label use. And we have examples of off-label use being done for vaccine products in the past.
And as you said, the science, and that is the important thing, the science supports the argument that a gap of between 8 and 12 weeks gives you better immunogenicity, it gives you better protection. That is what you're saying.
That's correct.
Can I ask you, have you had Covishield yourself? And if the answer is yes, will you delay the second jab for a 28-day gap or for a gap somewhere between 8 and 12 weeks? I'm sorry to personalize it, but can I ask you that question?
Sure, I've had Covishield and I will take a somewhat longer gap.
In other words, you will wait for something between 8 and 12 weeks. Is that right?
Yes.
Yes. Did you say yes?
Yes.
My last question. WhatsApp groups seem to have a message going around that suggests some people who've had both jabs of the vaccination still went on after a week to get COVID. In one instance, apparently there's a person who had COVID earlier, recovered, had both jabs of the vaccination afterwards, and then got COVID again. How do you respond to these outcomes?
No vaccines are perfect, and no vaccine will give you perfect protection. So it is feasible that people who have received the vaccine could get infected and could even be ill because of the infection. That's how we wind up with the 50% efficacy, 70% efficacy, 90% efficacy. There are some people who, even though they are vaccinated, still develop infection and still develop disease. So that is just something that we should be expecting to happen.
So the fact that people have got COVID after getting both jabs of the vaccine should not worry too much. It should not deter people either. This is to be expected. It will happen to some people.
It is to be expected at a population level. When you look at vaccine, you're measuring the efficacy, or after licensure, the effectiveness of the vaccine in the population. So there will be vaccinated people who will get disease. For an individual to know that they are actually protected from infection requires for us to have a correlate of protection. This is usually a serum or fluid marker that tells you that if you have X in your blood, then you are definitely protected from disease. At the moment, we have no such correlate of protection for SARS coronavirus 2.
So in other words, don't get disheartened. Certainly don't get worried and panicky by these WhatsApp messages. There will always be one or two people who, despite having both jabs, will still be, let's say, unlucky and get COVID.
And when they get COVID, it's very likely that that COVID will be modified to be much less severe than it would otherwise have been. So there is protection usually from vaccines for even more people. Again, so for example, severe disease and death are protected for almost 100%, whereas vaccine efficacy is only 90 or 95%.
That's very
the Pfizer.
Almost 100% protection against severe disease and death, given that that is what most people worry about. Those who had both jabs of the vaccine are almost 100% protected against severe disease and death. On that reassuring note, Professor Kang, I thank you for having made time available to me, and I thank you for clarifying both about the nature of the surge and the possibility or likelihood that in Maharashtra, for instance, it could be because of new mutant strains of the virus, perhaps very likely a local mutant strain. But as you say, the cases may be surging, but they are largely asymptomatic or mild. And more importantly, as you clarified about the vaccine, you yourself will take the second jab of Covishield, not after 28 days, but after a gap of between 8 and 12 weeks, which is what the WHO guidelines say. And as you said, the science supports this. The longer the gap, the greater the immunogenicity, the greater the efficacy, the greater the protection. I thank you for clarifying things, because I think these are issues on which audiences look for guidance, and yours is perhaps the best available in the country. Take care.
Can I add one more thing?
Of course.
So, my mother just got vaccinated. She's taken Covaxin. And for her, I would not recommend expanding the interval between doses, because for Covaxin, we do not have the data that tells us that an increased interval would lead to a better response.
Absolutely. I should have said to myself that the greater gap between the two injections is only for Covishield, because the science supports better immunogenicity and efficacy only for Covishield. For those who've taken Covaxin, please stick to the Government of India's guidelines and make sure you have your second jab after 28 days. Thank you for that clarification. I should have made it myself. Thank you very much, Professor Kang. Take care. Stay safe.
Thank you.